like to welcome our guest today. Uh, so I would like to welcome Nikhil sir. Thank you so much, sir, for finding out some time from your busy schedule and joining us. And orienting in this coming session, sir will be orienting us towards the well-known and very popular Ayushman Bharat Pradhanmantri Jan Arogya Yojana. So before Sir gives his insightful comments and deliberations on the said scheme, let me just orient and give and form a brief background about the topic today for which we are all here. So to my audience, this scheme is a very ambitious scheme of Government of India, and it represents a new India, and it was launched in 2018, September 2018. And the government is planning to give or have already given since September 2018 5 lakh in health insurance coverage for 50 crore Indian citizens. So that's the size and the magnanimous size of this scheme, and I'm sure Nikhil sir will further help us understand the implementation, the panel, how the hospitals got their concerned with this particular scheme. And I'll just hand over this session to Nikhil sir, and he'll further take over. Thank you, sir.
Thank you, Dr. Vaibhav. Very good afternoon to all of you.
Yes, sir. Sir, our audience may not be able to answer here, but definitely they are all ears.
Okay, not an issue. Can you see my presentation?
Yes, sir.
Yes. Okay. So, very good afternoon to all of you. So, as we all know that Ayushman Bharat Pradhanmantri Jan Arogya Yojana, this is the world's largest and the biggest health insurance scheme India have ever started. As Dr. Jayavardhan told us that the scheme was started in September 2018, right? And the Ayushman Bharat, that the name Ayushman, in India we say Ayushman means Dirghayushya, right? So the motto behind the scheme is that all the Indian, their age, they live long, right? There are two aspects of Ayushman Bharat basically under the title of Ayushman Bharat, right? One is Health and Wellness Center, and the second is Pradhan Mantri Jan Arogya Yojana. What is Health and Wellness Center? The Health and Wellness Center that running throughout the India, right? In the primary health care center, at village level, at urban level, all where. You can go over there. They actually learn the people how to get fit, right? Yoga sessions are going over there, and how can you prevent the illness? That is the basic thing of Health and Wellness Center. And the another part that we are going to learn today, that is Pradhan Mantri Jan Arogya Yojana. You must all have heard about this Pradhan Mantri Jan Arogya Yojana, right? Everyone have? Hello? Are you getting me?
Yes, sir.
Yes,
Hello?
yes, sir. They can hear you.
Yes, sir.
Fine. Yes. Okay. So as I told, this is the biggest health insurance scheme of the world, right? Because the total coverage of the people of under this yojana is around 40 to 50 crore Indians, right? Because this yojana is throughout the India, right? So, and as we all know that the India is one of the fast growing and the developing country in the whole world, and the total population is of the India is around more than 1.35 billion. And out of that population, 70% of the people are still living in the village and 30% of the people are living in the urban area. The number of the population is very huge. So that due to that, the India is facing a dual health problem, communicable as well as the non-communicable diseases, right? And which remain a threat to the health economy, because non-communicable disease example we have currently right now, corona, and other viral and bacterial diseases are there, right? And in the non-communicable diseases like cardiovascular disease, cancer, any kidney-related disease, then diabetes, etc. Right? Due to our lifestyle, the non-communicable diseases are more and more nowadays. Cancer, we can say, is spreading more and more. Right? So all the things that directly affect to the health economy of particular family. Right? And in India, the public spending on healthcare is very low. We can say lowest in the world. That is only 1% of the GDP. That is a very, very low number. If you see about the country, and few even small countries are there like Belgium, Netherlands, other surrounding European countries, they spend even 3 to 4% of GDP on the health, right? So they are more fit, right? And even IRDA, that is Insurance Regulatory and Development Authority, they have reported in year 2017 that 76% of the population do not have any health insurance. And that can put a financial burden on the family, and that results in a rate of out-of-pocket expenditure on the health. Because even if we right now we go to the village level, they don't even know what is health insurance, right? We are educated people, so may we have the health insurance for ourselves or family members. But if you'll ask around your neighbors even, then many of them don't know about health insurance, and even if they know, then they have not taken any health insurance for protection of their family if any health medical emergency will come, right? So that can burden a lot to the family. And in India, because of that high out-of-pocket expenditure on the health, annually 3.2% of Indian falling below the poverty line. That is also a huge number, right? And the 3/4 of Indians spending their entire income on healthcare and purchasing the drug. If a small family is there, which is a middle class, lower middle class, poor family, below poverty line, if they are living their monthly income might be around 50 to 20,000, we can say. Then if any medical emergency come to that family to a particular person, then whatever they have saved, the total entire their saving they spend to the medical emergency, right? So there's a high need of universal health coverage, and the universal health coverage means that whether the person is rich or poor, that is whether they're middle class, upper middle class, whatever is that, everyone should get the equal healthcare services according to their need without facing any financial crisis to the family, right? So government of India has introduced this scheme, Ayushman Bharat Pradhanmantri Jan Arogya Yojana. Now we will see the overview of the scheme. What is scheme? What is the benefit of that? Who are the beneficiaries of the scheme? How can we get the benefit of that scheme? Right. So the basic aim of Ayushman Bharat Pradhanmantri Jan Arogya Yojana is to achieve the sustainable development goal for providing a universal health coverage to at least around 40% of the Indian population, which is deprived of secondary and tertiary care medical services. Right. The cover under this scheme is rupees 5 lakh per family per year, right? If we take a private company insurance of rupees 5 lakh per family, then that amount per year we have to spend around 50,000 to 20,000, right? But this is totally free, no any family have to pay anything to the government. And the biggest thing is there is no cap on size of the family and the age of the family members. If we go to the private insurance company, then they have certain limitations, certain rules and regulation that family size should be this much only. The age limit are there. If with the number of people are increased, then the amount is also increased, right? The age should be between this, then the amount is this much. So here there is no limit, no any rules. That is totally cashless and paperless, right? And nationally portable services. If I'm living in Gujarat right now, I am eligible for Ayushman Bharat. I have the card of Ayushman Bharat Yojana. If I go to the Delhi, if I go to the Maharashtra, and something happened to me, if I have the card, then I can tackle services of Ayushman Bharat in any of the hospital which is empaneled under that Yojana, right? So this is nationally portable. Anyone can take a benefit of this scheme anywhere in the India, but that hospital should be empaneled under Ayushman Bharat, right? And for over 10 crore poor vulnerable families. So what is including? Pre-existing disease cover already from the day one of the enrollment. As I get the card, if I have any disease already it is there, then it's already covered. While in the private insurance companies, that's not covered, right? Pre and post hospitalization expenses, they are also covered. That is total, as we have said, cashless, paperless, and nationally portable services. Then fixed transportation allowance, that is also payable from the place of residence to the hospital. Right now it is fixed. It is rupees 300 is given to every patient when the patient is discharged from the hospital, right? Then the quality certificates for the hospital. This is what actually Ayushman Bharat Yojana have started the giving quality certificate to the hospital. They have decided certain criteria of the quality, like the golden certificate, silver certificate, and the bronze certificate. As per the hospital is fit to that quality criteria, then NHS, the National Health Authority, that's running the BPMJY, they give the quality certificate to that particular hospital. So now what happened when any hospital empanel under the Ayushman Bharat Yojana, then they now increase their hospital criteria, right? Because if we go to the village level, at urban level, then hospital, that doesn't matter, right? About regarding the quality. Very few hospitals we see in the Gujarat, they have the NABH certificate. If the hospital have NABH certificate, then NHA, that is National Health Authority, Ayushman Bharat, they give the golden certificate to that hospital. And what is the benefit of that golden certificate? That they give 10% of extra income to the hospital. If we have the bronze, if we have the silver certificate, if hospital have the silver certificate, then we can say that is a good quality of the hospital and patient can go over there and take the treatment, right? Now about the targeted beneficiary. Who are the targeted beneficiary under this Yojana? Right now, if we see in the Gujarat, the total are 43.85 lakhs families are there, which comes under this Ayushman Bharat Pradhanmantri Arogya Yojana. And till now, if we see the total families already covered, that is 22,58,805. This much family got the Ayushman Bharat card already, and they all can now take the treatment under the empaneled hospital. Till now, the total members covered are around 74 lakh. Now, who are the beneficiaries? That is D1 to D7 deprivation except D6 criteria. This is the deprived categories as the government have decided based on the socio-economic caste census of 2011, right? And the automatically included households are the without shelter, then living on MS, manuals, Avengers families, etc. they are the automatically included in this scheme. Majority of RSBY targeted beneficiary. RSBY was the scheme that was running before the Ayushman came, right? That is Rashtriya Swasthya Bima Yojana. The coverage of the Rashtriya Swasthya Bima Yojana was only 30,000 rupees per family, but Ayushman Bharat it is 5 lakh per family. Now, recently, if you have seen the news, the newly added category is the Ayushman CAF. A few category of the army, they are also now covered under the Ayushman Bharat Yojana. So now they also can get the benefit of Ayushman Bharat Yojana. Now what the targeted group of the rural area, right? So these are the category as we talk. What is D1, D2, D3, D4, D5, and D7, except D6. So these are the categories. D1 only one roof, D2 no adult member, D3 female headed household, D4 disabled member, D5 SC/ST household, D7 landless household, right? And automatically these are the automatically included criteria which comes under the Ayushman Bharat in rural area. These are the target group of the urban area. So who can come under this scheme who are living in the urban area. So these are the people like rec pickers, domestic workers, street vendor, sweeper, home-based worker, transport worker. This is the old data the government have taken basis on the 2011 census, right? This is the service delivery and the key feature. How the patient can take a treatment. If you have the Ayushman card, how you can take the treatment. When patient get hospitalized first in the hospital, when patient go to the hospital, then the one beneficiary identification and registration system is there. Then they put the pre-authorization process. Then patient get the treatment, then claim request and the discharge. As we know that right now India is totally a digitalized country, or we can say that we are going to the digitalization day by day, right? So this is the scheme is totally a paperless. This is totally on the digital platform right now. So if anyone wants to empanel their hospital under this scheme, then there is a one particular website is there. On that you can go and apply online, and then you can get empanel your hospital under this scheme. Then self-identification of the citizen. Now this is the biggest thing actually we can say. If I am the eligible person this Ayushman Bharat Yojana or not, how can I get to know? There is a one website. This is called mera.gov.in. Here we can say. We can see here. You can search your name. Anyone can access this website, right? You have to just find out in the Google mera.pmj.gov.in. You just add your mobile number. You will get the OTP. You add the OTP, and one form will get open. You just put your few information, your name, your village name, your age, few criteria, and then you search. Right, people, then your name will come, right? So you also can search for your relatives also. If you know, we have seen the criteria, right? Before the D1 to D7 categories. If your any relatives even fit into that criteria, and if you think that they are the eligible for the scheme, if still now if they don't know whether I'm eligible for the scheme or not, then you can search your name in this website, right? Then the verification of beneficiaries. Now, once I get to know that I'm the eligible for this, but from where I have to get my card of Ayushman Bharat, and on another website, that for that you have to go to the empaneled hospital. You have to show your HHID, that is household identification number. Once you get it, that is on mera.pmj.gov.in, right? Then you go to the empaneled hospital. They will search your name and they will make your card. Now, what are documents? This is the basic thing actually. We never know, right? Even so many people are there around us. They actually need, right? even if we go to the at least village level, then it's highly required that people get their card as earliest, because daily in routine we see that many of people, they have their name in this yojana, but they don't know from where to get the card, and suddenly any medical emergency is there and they are in rushing, and then mm, going right. So many issues are there, so it is better that at least before any medical emergency comes, at least they have the card, so at the time of emergency they don't have to rush here and there, right? So transaction as at the hospital, that is actually the hospital part. And that is, and another thing is grievance redressal. There is one particular portal is that if you have any grievance regarding the yojana, right, then you can directly log on to the this grievance redressal portal, and then you can log on and complain on that, and then you will get the reply for that. Then program guideline and policy, you can log on to the pmj.gov.in. From that only the website you can get the link of all other portals of the PMJY, right? So this is totally a digital platform and technology embeddlement program. So these are the some website as we have already discussed. These are some options from where you can get to know whether you are eligible for the scheme or not. PM letter is also there in many villages and urban area. When the scheme has started in the beginning, the Pradhan Mantri has sent their signed letter, that is called PM letter, where the HHID number is there, the eligible family name is there, all the member name is there, and they send to the village level directly to the home of the eligible person. But somehow if the people did not get the letter, then they can search through Mera PM. This is the actually best option you can do from your mobile, even wherever you are. You can search anyone's name from that. Even if you go to the hospital, then one person in the hospital, particular desk is there for the Ayushman hospital. From there also you can search. Then common service center is there. From there you can also search your name whether you are eligible or not, right? So this is the overview of Ayushman Bharat Yojana. Now we also know that the Ayushman Bharat Yojana that was just introduced in the 2018, but that Yojana basically comes from one another Yojana of Gujarat itself. When Prime Minister was the Chief Minister of Gujarat, they have already running this Yojana very successfully. That is Mukhyamantri Amrutam Yojana, right? Everyone heard this name, Mukhyamantri Amrutam? Can anyone? Hello? Hello? Am I audible to all?
Yes, sir.
Am I audible now?
Yes, sir. It's
Okay.
audible. Yeah.
Okay, fine. So one more scheme is there, Mukhyamantri Amrutam Yojana. Everyone heard this? Because this is so popular scheme of Gujarat for any regarding health insurance, right? So many of you have, I hope, at least you have this card. This kind of card, I have kept the photo over here. Anybody have this card from Gujarat? Anyone? Okay, not an issue. So what is Mukhyamantri Amrutam Yojana? We will see, right? Mukhyamantri Amrutam Yojana is basically, it was started in 2012, right? That is for the BPL families of the Gujarat only. The people who are under the below poverty line, that was listed already based on the census, right? So Mukhyamantri Amrutam Yojana initially have started for in 2012 for BPL families only, and at that time the coverage of that Yojana is 1.2 lakh around, right? 2 lakh, and then after that, in 2014, government has thought that if only the BPL can get the treatment, then what about the what about the middle class families who are actually not affordable to any kind of medical emergencies? Because there are people who are middle class or lower middle class. They are not actually in the list of BPL families, but they are not affordable. If any medical emergency comes to that particular family, then what about that people? So after that, Gujarat government has introduced a Mukhyamantri Amrutam Vatsalya Yojana, right? And there is the one criteria of income certificate that we will see later on. Now, the Mukhyamantri Amrutam Yojana that also gives the coverage of rupees 5 lakh per family per year. Before it was 2 lakh, then increased to 3 lakhs, then now it is 5 lakh, right? And the total number of procedure is around 1805 identified procedure, that along with their follow-ups and same as Ayushman Bharat. Before October 2020, both the schemes are running differently on the IT platform. But now the Yojana and Ayushman Bharat, the government has merged this scheme, right? So the same way there is no cap on the size of the family or age of the family members. As per the Ayushman, that this scheme is also cashless, paperless, but this is actually not a nationally portable scheme, because this is for the only Gujarat. In anywhere of the Gujarat, in any district, that is portable. If I'm living in Rajkot, if I'll come to the Baroda, if I'll come to the Surat, if I'll come to the Ahmedabad, anything happens to me, I can get the treatment over there, right? Because this is the scheme running by the Gujarat government only. The same way the pre-existing disease covered from day one, right? Then pre and post hospitalization expense covered, then cashless, paperless, right? And then fixed transportation allows, the same way as per the Ayushman Bharat. And as I said, this scheme is merged with the Ayushman Bharat Yojana. Now, who are the targeted beneficiaries under Mukhyamantri Amrutam Yojana? As I said before, as in 2012, that was only BPL families as per the list of Rural and Urban Development Department. After that, in 2014, the families having annual income, when the scheme started, the income criteria was 1.5 lakh, then it increased to 3 lakh, then now it is 4 lakh. So now if you want to get the Mukhyamantri Amrutam Yojana card, right, then your family annual income should be not more than 4 lakh. It should be 4. Then you can get the Mukhyamantri Amrutam Yojana card, right? The another category is senior citizen category. Senior citizen category with annual income up to 6 lakhs. They are eligible for this. Then UIN card holder. Then all the urban and rural ASA. ASA is accredited social health activist, right? Then the reporters. Then the fixed pay employees of class 3 and 4, that is appointed by the state government. Then all sadhu sant, orphanage home, old age home, etc. So these are the targeted beneficiary. If you fall below under this category, you can avail the Mukhyamantri Amrutam Yojana card. And till now, families enrolled under the Mukhyamantri Amrutam Yojana card in the whole Gujarat is around 53,37,892. These are the number of active card, right? In Ayushman, what is there? That in all the family, if you have 5 members in your family, right? All 5 members will get individual while Mukhyamantri for the family. Now, these are the some feature of the scheme from where you can get this card. As we seen in the Ayushman Bharat Yojana, you can tag the card from the hospitals. For this Mukhyamantri Amrutam Yojana, there are a kiosk, right, running by the government that's available in all the taluka level and in the 67 civic center that is in the corporation area, right, in the city area. From there you can get the card. Then each enrolled family is given a QR code. That is, you have to first give your thumbprint, that is Aadhaar based, and you will get the card. And Ma Vatsalya card is compulsory for the availing the treatment. When you enter the hospital, if anything happens to you, you go to the hospital in emergency or anything. But the thing is that if you have the Ma Vatsalya card, you have to be with that. If you have the photo, then also not an issue, right? And after availing a income certificate, because Ma Vatsalya is the based on the criteria of income certificate. So after availing the income certificate, beneficiaries can get the Ma Vatsalya card along with the ration card and Aadhaar card. So this is the three basic documents you should have or anyone have who willing to get the Mukhyamantri Amrutam Vatsalya card. That is income certificate, ration card and Aadhaar card, right, as a ID proof. If you don't have Aadhaar, you should have election card, right? So these are the basic three certificates or documents we can say, right? And the benefits to unit of 5 members of the family, that was in the beginning. Now there is no criteria. Your all member name should be in the ration card. That is one family, right? Now this is Mukhyamantri Amrutam Yojana. That is the health assurance scheme. This is not insurance scheme because there is no insurance company involved in the whole scheme above, right? Because the payment of this scheme to the hospital is directly done by the government itself, while the ABPMJY scheme, Ayushman Bharat Yojana, that is insurance plus assurance scheme. Because in Ayushman Bharat, what is that? Actually, this is for the hospital part where below the 50,000 or below the 50,000, that payment is given to the hospital by insurance scheme. Government hire one insurance scheme and then they do the payment of 50,000 or below 50,000 cases to the hospital, right? And above 50,000, government will directly pay to the hospital. There are some package rates, they are already decided, right? If any hospitals have to empanel under the scheme, then government has decided the package rate of each and every procedure under the clusters. Then if the hospital is agree with that, then they can get the empanel under the scheme. And payment against the approved claim is released directly to the RTGS. So there is also no any paperwork, right? As we have discussed, this is paperless scheme, and directly amount go to the in the account of the hospital, right? Right now, there is one supportive agency, that is MD India, that is work as a supportive agency to the government. They do the work of clarification and the of the all the claims done by the hospital, and then submit to the government, and government will directly pay to the hospital, right? As per the Ayushman Bharat, here is also a beneficiary get ₹300 for as a transportation allowance, right? And this is 100% state funded scheme, right? While in Ayushman Bharat, the 40% fund is given by the central government, while the 60% is given by the state government. And in Gujarat only, if we see, then there are around 2,400 network hospitals are there, including government as well as private. As we have discussed regarding the quality certificate, if any hospital have NABH, JCI, ACHS accreditation, right, then they are eligible to get 10% extra as a quality incentive over and above the decided package rate, right? So this is more beneficial to the hospital. And here is the site and the toll-free number. If anyone have any query and if they want to ask, they can directly call to this number, right? So this is about the both the schemes and overview from where you can get the card, from where you can get the benefit, and how the scheme is beneficial to all the needy people of India. Because what happens that if any poor family, we can say, if they get any medical emergency, then their whole saving goes to the in medical treatment, right, in a single shot. So it's directly affect to the living standard of the family. So this was about the Ayushman Pradhanmantri Jan Arogya Yojana. If now anyone have any question, then they can ask. Hello.
Hello.
Hello. Yes.
Hello, sir. Can you hear me?
Yes. I can.
Sir, I'm Binod. I'm Dr. Binod from Nepal. Actually, I live near Kathmandu.
Okay.
So actually, I have one comment, one information, and few questions. So
Yeah,
comment
please.
is, thank you so much for your time management with this session. Actually, this is a great encouraging session for us, and especially for Nepali government as well. And because we can see a lot of schemes for vulnerable populations as in your country, and that's really great. And one information is that like Nepal is struggling with the insurance scheme. Actually, where I don't have insurance. That means like the government is actually struggling with many things, and one of the aspects is so. I have one question, which is like, who is responsible for the enrollment into Ayushman Bharat program? Like, because I see a lot of misutilization of the program or sometimes misuse. And what were the challenges? Because it's already enrolled in 2018 September. So what were the challenges, and how did you like? How were they tackled? Those are the challenges, sir.
So actually, biggest challenge now is because in Ayushman Bharat the beneficiaries are limited, right? As I have told, there are 40% of Indian population covered, right? But now the actual beneficiary, if they will not get the benefit, then there is no use of the scheme, right? The biggest challenge of the scheme is right now they have used the data of 2011 census. If any person lives in 2011, if they are poor and now their financial condition is better, then they should not be the part of the scheme. Because if any person is really need, right, medical treatment, and they are not financially capable, then they should get the benefit. Actually, this is the biggest challenge of the scheme. So government working on that actually. So let's see, because this is the policy decision we can't take, and the scheme is running in the whole India, right? But the benefit of the scheme is that at least I'm working as a district project coordinator, so on the daily basis I see that at least many people are getting benefit of this scheme, right? If they do not have the card of this scheme and they not get benefit or support from this scheme, then they really have to die. I have seen the people of that only.
Okay, thank you so much, sir.
Yeah. Anyone else?
Yeah. Anyone who have any query or anyone wants to comment on this session? Okay, so we'll consider this a no, and I hope and I'm sure that this was a wonderful session. Thank you, sir, for finding out your time, and this was a wonderful session. And just want to pinpoint one important thing that sir mentioned during his session, that this entire process, this entire will be or is mainly intended to improve the quality of life and the standard of living of the Indian population, of the Indian citizens. So it is the onus, it should be a responsibility of the citizens to utilize these services in an effective, efficient manner, and not just burden up the system like it has always been. People tend to overburden the health system even when those who are not who do not needs the have the need of these programs, or you know but those who are actually in need, they sometimes get devoid of accessing these services. So it should be one's onus and the responsibility to use these services, use these privileges as a responsible citizen. So yeah, that's it from my side, and I'm very sure that this was a very informative. We are getting comments in the comment box that this was a very wonderful and informative session, and I again thank you, sir, and I think we can conclude this
Thank you.
session now. Yeah,
Yeah. Thank you so much.
thank you, sir. Yeah. Thank you all for joining. Thank you.